All right, I'm live. Just arrived at Foundation Performance here. I'm gonna try to get myself dry needled. I am aware I do have to wear this mask the entire time. Gonna get my shoulders done, so I might have to lose the shirt. But yeah, so I'll try to speak pretty loudly. Same deal with Mike. We got to keep our masks on, but yeah, I'm gonna give this dry needling thing a try. It's gonna be good, I think. Right,
great.
Mike? It's gonna be great.
It's gonna be great.
Say hey to the crew. Usually
guys.
we're split screen.
Well, welcome to the torture chamber.
Come on
I
now.
mean the physical therapy office.
It's gonna be wonderful. This is good stuff,
This
right?
is great.
We're not getting tortured. So I'm gonna throw the old phone in the tripod here, and then disrobe, I guess.
Yeah, so you tell them
Just
where
the
to
top.
needle.
We're gonna do the top. We're gonna do some traps.
Yeah, we're gonna do upper traps in here, so we need you to take your shirt off.
All right, cool.
If you have the sports bra on, you can leave that on.
I can leave my sports bra on. Fantastic.
Yeah.
Cool. So you want to tell us a little bit about dry needling? What's the deal with this
Yeah.
stuff?
So the technique that we do is called trigger point intramuscular dry needling. So we use a small monofilament needle, which is basically an acupuncture needle, to get into muscular trigger points and to try to release them.
Okay.
It is, in my opinion, in the 20 years I've been doing this, the quickest and most direct way to get rid of muscular trigger points.
Okay. All right.
Muscular trigger points will affect your range of motion,
Mhm.
will affect your strength, will cause pain, will cause dysfunction, will cause problems in other areas of referral pain.
Okay.
So they're nasty and they're very common with runners.
Trigger points.
Trigger point.
Cool.
So
Yeah.
do you know what a trigger point is?
Yeah, isn't it like when those muscles get all kind of
Yeah.
tight up? I've heard that term like 4 or 5 times now that we've been doing coffee talk.
Right, it's a lot of talking about
There's
trigger
a
points.
lot of trigger point talk going on.
Yeah, and it's just because of the repetitive nature of running, it's very common.
Yeah.
So this is, in my opinion, one of the best ways to get rid of those muscular trigger points.
Okay. Fantastic.
So basically, what we're going to do is we're going to palpate, try to find that knot,
Yeah.
a lot of people call it, in the muscle. I'm going to pop a small needle into it. I'm going to move it around a tiny bit.
Yeah.
We're going to get what's called a twitch response, or I call it the WTF moment.
The WTF moment.
WTF moment. Because it's a weird sensation when your muscle will kind of just twitch like that, and you're going to go, what the hell is that?
Oh.
WTH moment. What the hell is that?
What the hell? What the hell?
So, and then we're going to put a little electrical stimulation on here, and we're going to cause the muscle to twitch around,
Oh,
and
all
that's
right.
going to help globally free up the tension from that muscle. I find that we get a more overall full muscular benefit when we add the electrical stimulation to it.
Okay. Is that a fairly common practice,
Mhm.
the
Yeah.
electrical stimulation?
It's
Okay.
not legal in any state except Massachusetts, Rhode Island.
All right,
Just
good.
kidding, yeah. It's very common.
Yeah.
Most dry needle courses that teach it include electrical stimulation with it.
Okay, cool. Before we start,
Yeah.
can I take a look at the needle?
Yeah.
What are we doing? How big is this thing that you're
Right.
sticking into my trap?
All right, I'll show you both ends of the spectrum here, okay?
Mm-hmm.
Okay, I'll show it to the camera.
Mm-hmm.
So here's the smallest needle we have,
All right.
which if you look inside
Not
the
too
needle,
bad.
no,
Yeah.
the needle's about the size, not even the size of my thumbnail.
All right.
Okay.
All right. I can dig that one.
Yep, and then we got this guy, which is like
Yeah.
a straw from a Venti's iced latte at Starbucks.
Yeah. I don't want any part of that.
We're not going to use
We're
that.
not. Okay.
Because if you see how big that is, that would go right through.
That doesn't go. Yeah.
Yeah,
I
we're
don't
not
need
gonna do
any
that.
of that noise going on.
No, and you're lean and mean, so it's hanging out right, pretty superficial. So we're going to use
Cool.
probably maybe a 1/8 of an inch longer than this one. But that's basically our full range there.
Are there any in between there?
There's a whole bunch
A
of them.
whole like spectrum.
Whole spectrum.
Gotcha.
So the deep ones, like that big one, we use to get deep into a glute muscle.
Oh, okay.
And this area here we tend to be pretty small.
All right. Cool. You want me to dive into this thing?
Yeah, just real quick, I want to make sure
Yeah.
everyone knows this. Like you and I already had our medical clearance conversations.
That's right. I had to fill out a form.
Yes, you
I had
did.
filled out a dry needling consent form, and I read it very thoroughly. and I agreed, signed it.
Yeah.
And I had to take a COVID thing. That's why we got our masks on the whole time.
Yeah. Totally safe.
Totally safe, right?
Yeah.
And so you wouldn't do it if it wasn't safe, obviously,
No.
right?
Obviously not.
Yeah.
Yeah.
So
And there's really not too many things we can't do it with. Like, you know, we asked if you're pregnant, are you immunocompromised, do you have like a bleeding disorder,
yeah.
do you have a fear of needles? There's certain things that we need to be aware of.
Right. Right.
You know, we wouldn't do it, you know, if you were a cancer patient, we wouldn't do it near sites where there's tumors. You don't want to increase blood flow to certain things.
Right. Right.
So besides that, we're pretty
We're
good.
pretty good.
Even the biggest risk with any needle puncture is infection.
Okay.
But they'll see the cleaning technique we do. The needles are sterile. It's a very, very clean technique.
All right.
That risk is almost zero, but we have to be okay with that.
Yep.
There may be a little bruise, there may be a tiny drop of blood, but that's pretty much it.
All right. Cool. Let's do this.
Let's
then.
do it.
All right.
You're
So
gonna lie in your bed.
laying down, and yeah. So I feel like these trap muscles get super tight, you know, from holding cell phones, computers, typing on them.
Yeah.
So I thought it'd be a good spot to get needles,
You know?
loosen it up a bit.
You know, too many of us are on cell phones and laptops too much, so these get tight.
Yeah.
So first thing I'm going to do is wash off the area with some alcohol.
Okay. Cool.
Make sure that you don't have any toxins hanging out on your skin.
Yeah. I try to get those off in the shower. The
Dude.
toxins, you know.
That might not work.
Yeah.
Was the weekly shower today? That was a joke.
That was good.
He showers more than once a week.
I try to anyway.
Alright. I'm going to clean my gloves. The gloves are sterile, but I'm going to clean them just in case.
Cool. And so with this dry needling thing,
Yep.
am I gonna bother you if I talk to you? Do you have to like have intense focus? Are you so skilled at this that you can have a conversation while you're doing
I
it?
can't have a conversation, but before you ask me anything,
Yeah.
I hope everyone can hear us over there.
Yeah.
You're going to hold this in your left hand.
Okay.
That is one end of the electrical current.
Okay.
Okay, you just relax your hand. You don't have to death grip it.
I'm a little terrified
Yeah.
with the electrical current.
Don't be terrified of that.
Alright.
You can fire away any questions, and before I insert the needle, I'll let you know.
Alright, cool. So with the dry needling thing, is the idea to release trigger points? Does it help with like blood flow
Yeah.
to that area?
Yeah, exactly. So as soon as you put the needle in, some things happen immediately.
Mm-hmm.
So blood flow increases,
Yeah.
inflammatory chemicals that will be hanging out in that area, which are present with trigger points,
Yeah,
will start to release.
Okay.
The nervous activity, so think about it like volume. So your trigger point, these fibers are stuck together. There's like almost like a vibration, or like the nervous system activity is really high.
Yeah.
As soon as we put that in, that central nervous system activity drops down.
Oh, interesting.
So that's immediate. So we can go in and get that, and when you get the twitch response, that's even better. That tends to be more of a release.
Okay.
And then, so we do that, and sometimes we don't use the stimulation.
Ah,
So if I get a
right.
great twitch and I don't feel the need to electrify you, I won't.
Oh,
We might do it just for their entertainment.
yeah.
But yeah, so not everyone gets the needle. I mean, not everyone gets the electricity.
Yeah.
Not everyone gets needles, obviously, but
Right, right.
when we do, sometimes it's just putting in the needle, getting the twitch response, and then moving on.
Got it. All right.
So sometimes it's as quick as like 5 seconds.
Right.
With you, I may do about a minute with the electricity.
Oh, all right. It feels pretty rough in there. Is that what you're telling me?
Can you feel that little ball right there?
Yeah, I can feel that.
Yeah.
That's
So Eric has what feels like an almond hanging out in his trapezius muscle.
yeah.
So,
Yeah.
tiny little needle here.
Yeah.
You're going to feel a pop,
All
a
right.
little tap. Not bad, right?
Did you do it? You did it
It's
already?
already into the skin.
Oh, wow. All right.
Yeah.
I didn't even notice that.
Yeah, see?
Probably because it hurt so bad with you squeezing it.
Right.
It's already, yeah. It's really tight, man.
Do you feel that little twitch?
I did, yeah.
Yeah, so you guys can't see it, but you have a little twitch. When I do the other side, maybe you'll be able to see it.
Right, right.
Alright, so we got a couple little twitches out of it.
Mm-hmm. So is it easy for you to find those little trigger points? They're
Yeah.
pretty, like, easy to track down?
For the most part, they are.
Alright.
You know, you've got a really superficial muscle. Your kind of a smaller dude,
Yeah.
right?
Yeah.
So pretty lean to means everything's pretty exposed.
Got
Like
it.
when we get into glutes, sometimes those are harder to find, the trigger
Yeah.
points, because it's just more tissue, bigger muscle group.
Right.
But we can still find it.
How do you go about like finding that thing?
You palpate it. So the first thing you
Yeah.
look for, it's almost like a football-shaped type of
Mm-hmm.
like firmness to the muscle. And
Yeah.
it typically goes along with some discomfort. When I squeeze it, you see like the eyebrow effect, and people are like,
Oh,
oh,
all right.
that hurts,
Yeah.
you know?
Yeah. Yeah.
Or I ask you, is that a little uncomfortable? People usually just give you that information, like, well, that hurts.
Yeah.
And I
Yeah.
can feel that elongated football shape to it, and
Yeah.
I'm pretty sure that's a trigger point.
Got
And we
it.
try to get to the center of that trigger point.
Interesting.
So I'm not letting go. You can feel me squeezing your trap.
Yeah. Yeah.
We're really close to your lung field here. I don't want to have a needle somehow just change direction and give you a pneumothorax.
That sounds like a terrible thing. A
So-
pneumothorax.
Yeah, see, you signed the form, so it doesn't matter if I give it to you.
Right.
So, and you guys will see when I get to the other side, I'm just holding the muscle away from your ribcage.
Oh, okay.
Okay.
Yeah. Yeah.
So now we're going to use my point stimulator,
Mm-hmm.
and we are going to get a little contraction in here. And you might feel it into your hand as well.
Oh yeah. Huh? Look at that.
Feel that?
Yeah. That's the WTH moment, right?
We already had that. This is a different moment.
This is a different.
We're having another moment, Eric.
This is just filled with wonderful moments.
Yeah. Yeah, you guys may not be able to see it on the camera there when you get over to the other side, but we've got him twitching about one muscular contraction every second.
Yeah.
And I'm going to go a little bit faster.
Oh yeah. Look at that.
Feel that?
Yeah,
Not
definitely.
uncomfortable, right?
No, not really. It's kind of like we have this like massage gun at the store.
Mm-hmm.
It kind of feels like that, just like a little deeper.
Yeah.
You know?
What's great about this technique is it has a direct effect to the central nervous system.
Mm-hmm.
All our injuries have some sort of central nervous system component
Yeah.
to them. And this really helps calm down, like I call it, the volume of the nervous activity.
Yeah.
And what they found is when I release your upper trap,
Mhm.
we might find an improved function and less tension in muscles down in your arm just by
Ah.
releasing here, because of their connection to the central nervous system.
Huh.
So-
Everything's connected.
Yeah, see, needle is out.
Yeah.
Does that feel any different in there to you?
Yeah, it feels a little better. It's
Okay.
not like it's easy to make me squirm, you know?
No, so that trigger point is now hopefully slightly more released.
Yeah.
I can feel the difference. It's more like a flattened almond now.
Right, well that's good.
Yeah, so that's a little bit looser.
Yeah. Cool.
That's awesome. So let's go to the other side.
Let's switch it up a little bit.
Yeah, let's put that, let's show it in your other hand.
Sounds like a plan.
So they'll be able to get a little more of a direct idea of what's going on here.
Right, right. So you'll have to track down that almond. So I know you, so if you have this almond on the top of your trap, right?
Yeah.
How do you get it like in the glute muscle? Like how do you figure that spot out? Do you have to do some manual like massage down there to like find that spot, watch the reaction,
Yeah.
and then you dive in?
Yeah, you gotta palpate,
Mhm.
so you gotta touch and
Yeah,
really get in there and try to find it.
got it.
And then when you find it, you kind of don't lose that spot. You usually keep your hand on it or
Yeah.
know where it is, and then you kind of direct the needle right
Do I
into it.
switch hands? I switch hands with this
No,
thing?
you leave it right there. You're good.
Cool. All right.
I'm totally off camera here, but that's okay.
That's all right.
You know, I'm gonna move this a little bit, to give them a better view.
Sounds like a plan. So, one more question, or more, there's gonna be more questions, because
Yeah,
it's
that's fine.
craziness. But, so are there any certain spots in the body where this is like more beneficial than others?
No.
It just works kind of across the board on every muscle group,
Yeah.
yeah.
Yep.
Are there any specific spots that, oh my god, that hurts a lot.
Okay. Hold that thought 1 second.
Right,
So you guys can see, I've got a bigger than an almond here.
yeah.
This is more like a walnut.
Oh,
And
all right, I'm on
what
that.
was your quote? What did you just say? That hurts.
I said, ow, that hurts, yeah.
Yep. So that right
Oh,
there,
yeah,
that's the center of the trigger point.
jeez Louise.
If any of you don't want to see a needle go into his muscle, turn away now.
Right.
But we're going to go at it here. So
Cool.
now we're going to do a little tap.
Yeah. Oh. Yeah, that's not bad.
Right?
Is it in there?
Yeah.
Yeah, look at that. It's like less painful than like a flu shot, for sure.
Yeah.
You know? Although I don't know if I'd say the same thing with that ginormous needle you
No.
showed me earlier.
So I don't have a needle in there right now
Oh, right.
because it came out of your skin, and I don't want to put that one back in, so I'm gonna get a different one.
Well, look at that. So my question I was going to ask is, are there any particular spots in runners specifically that you tend to have more of this dry needling going on? Like if they come in and they are getting dry needled, what
Yeah.
spots do like runners typically get looked at?
Yep. So most of the time I would spend on hips, so
Yeah.
glutes, adductor, so the groin area,
Mm-hmm.
quads, calves, and lumbar spine.
Okay.
But believe it or not, we do a lot up in this area because of all the arm swing.
Oh, yeah.
You know, and then when they're not running, most people are sitting on their phones or on their laptops at work.
Right, right.
Here comes the tap.
Yeah,
So they get a lot of tension here, and that can mess with your arm swing.
right.
How you doing?
Oh, yeah, there we go.
I don't know if you guys saw that. My big monkey hand is in the way,
Yeah.
but that was a nice twitch.
Oh, yeah, huh?
Yeah.
And you didn't even have any electricity going
No,
on.
so I think we can see it. Yeah, we're good.
Yeah.
All right, so you guys are gonna see this start to twitch around.
Oh, yeah. That is like it's so weird because I'm not doing that.
Yeah.
But it's just happening.
You can't control it.
No? That's
We're bypassing your brain, hijacking your muscle right now.
Ah.
Feel okay?
Yeah, yeah. So it's just
So-
a interesting like sensation to not be able to control your own muscles.
Yeah.
You know?
So I'm hoping you guys can see this. Someone wrote in and said, "What happened to Eric?"
Well, he's getting needled. Oh my goodness.
So I'm gonna pick up the pace. So if you can see that thumping, which is about a
Yeah,
1 thump per second, we're gonna go faster.
yeah. And it feels interesting. It is. It's like that massage gun, but it's like inside of my muscle.
Right?
Yeah, it's so weird.
And not torture.
No, it doesn't feel like it's not painful. It's just kind of like a weird sensation.
Yeah.
That's all.
All right. So we went back down slow.
Yeah.
Hopefully you guys can grasp that.
And how do you decide like how long you're gonna palpate for, and how, like what the rate is, and all that stuff?
So, depending on the muscle, and we palpate as long as we need to try to find that area, right?
Okay. Yeah.
Yeah, so that walnut is flattened.
Yeah. Look at that. Huh.
So we palpate as long as we need to be confident that we've got the trigger point, and that's what
Yeah.
we're trying to solve, is that trigger point issue.
Right.
We'll put the needle in. We'll do a technique called pistoning, where we kind of put the needle in, and then we'll come in different directions to try to get as much of that twitch response as we can initially.
Yeah.
Depending on the muscle and the person and the response to that, sometimes we're done, we pull out, and we're good.
Right. Right.
Or if not, if we want to get more of that global effect, then we'll add the electrical stimulation. I typically cycle through a low frequency and a high frequency twice.
Yeah.
And you can actually feel the contraction, the difference of the quality of the contraction. So when it's nice and smooth and like snappy in a good way, then we know we achieved what we need to, and we're done. For some reason, for some people it's 30 seconds, for some people that could be 2 minutes or so.
Okay.
But usually not much more than that.
Got it. So you just kind of not play it by ear, but like you have an idea based on how it feels
Yes,
to either
exactly.
dial it up or dial it down or whatever you gotta do.
You got it.
Cool. Am I good? Am I done?
You're done.
All right. Fantastic. Cool.
Do
So,
you feel any different now that you're upright?
yeah, dude.
Yeah.
Yeah, I feel good. I'm gonna put my shirt on just for everybody's benefit. They don't need to see this.
It is Instagram.
I know, right?
Most people are shirtless or.
That is true. They're showing off their abs most of the time. But yeah, so that's cool. So is this something you do regularly?
Yeah.
Like if I have this issue, just like come back, schedule an appointment.
Yeah, so it's not a miracle where it's just one and done.
Yeah.
So we use this as part of an overall therapy program if needed.
Mhm.
So you might come in, we might have to do some postural work
Yeah.
to make sure the posture's okay. Talk to you about
Yep.
this. And then we would use the dry needling to help get rid of some of those trigger points, show you exercises to follow up to maintain the health of the area we treated.
Okay.
So it's part of an overall treatment plan. with some runners, they respond really well, and we're doing like a maintenance program.
Yeah.
They come in and we just find it once a week, once every 2 weeks, and we just find the trigger points, get rid of them. They know their exercises, and then they're off and they're on their way.
Okay.
So sometimes it's a maintenance, non-insurance physical therapy type of client we use it with,
Yeah.
and sometimes it's directly after an injury or surgery that we're using it.
Got it. Do these trigger points just come from like repetitive exercises? So whether I'm like a runner or I'm a baseball player, I'm throwing every day. So it's just repetitive.
That's one theory that they come from repetition.
Mm-hmm.
There's some sort of straining to that area.
Okay.
So like with running, the stresses and strains of running aren't dispersed symmetrically throughout the muscle.
Mm-hmm.
So that's why we'll tend to find like lateral quad. There's a little more friction that goes on the outside. So lateral quad and IC band and lateral hips, we might find more trigger points than medial quad on the inside of the thigh.
Okay.
So, but it's some sort of overload to the tissue, could be some sort of spinal problem. So a lot of times what we'll do is when we have a segment in the arm or the leg, we'll find the spot in the spine where that nerve root is coming out, and we might have to treat that segment right along the spine, as well as out here.
That's interesting. Yeah.
And people get nervous, but it's very, very safe
Yeah.
because your spinal cord and those nerves are protected by your vertebrae.
Got it.
So it's really easy to get to the muscles and to reset everything in there. So basically, dry needling is like a big reset to the muscle and your central nervous system.
Yeah.
And
Just
you
like
can-
the reset button.
Just like the reset button.
Yeah.
And then you can find benefits for up to 24 to 48 hours. So some people feel an immediate, like, oh yeah, that feels looser, there's definitely a change, a difference. Some people get sore like they worked out. Most people within 24 hours, like you wake up tomorrow morning hopefully still feeling a little bit looser
Yeah.
from what we did.
How long does it take for me to like go back to being terrible?
Minutes sometimes, depending on who you are and what you're doing.
Yeah.
Like if you left here and went right back to the store and just, did all your social media right now nonstop and your head's bent over and you're in front of your screen the rest of the day,
Yeah.
you'll probably get rid of 90% of that benefit.
Right.
But if you leave now and do some stretching, give you some recruiting activity for those muscles, that will make that benefit last longer.
Got it. So it is part of like a whole like exercise, not exercise routine, but just a change in your like lifestyle.
Yeah,
You have to kind of maintain to get the benefits
You got it.
long term.
Yeah, it's not like the magic pill. It's the closest thing to a miracle and the magic pill we have, in my opinion. But you still gotta do all your self-care.
Yeah. Are you working on that magic pill though?
Yeah, it's gonna be out in 2022.
All right. Cool.
Yeah, you can only get it in Germany or Mexico. It's not gonna be right here.
Oh, you gotta get to the FDA.
Yeah, it's a big hassle.
It's a whole thing.
Yeah.
All right. Cool. Well, I think we gotta wrap this sucker up. But thanks for watching, and thank you very much, Mike, for the tutorial on dry needling.
Yeah, if anyone has any questions about it, you can get a hold of me through whatever links or whatever we put on the videos here.
Yeah.
However that works.
Yeah, you follow at MyRunStrong on Instagram. Search for Foundation Performance, and you can definitely find a way to get a hold of Mike. And so yeah, thanks. This feels great.
Awesome.
Appreciate it. Thanks
See ya.
again for tuning in. Bam.